day of your life. I, Isha, welcome you all to this wonderful event named Professor Dr. Ali Irani's Coffee with Us. Okay, so I would request to everyone to please have a round of applause for him. For this, I require that let me introduce the host of the ceremony, Mr. Ashish Mathur sir. I would request everyone to please have a round of applause for him. I would also welcome Professor Dr. Ali Irani sir. He is a renowned and honored personality in the field of physiotherapy. His proficiency is highly sought after in the sports world. He is a physiotherapist for Indian cricket team from 1987-1997. I would request everyone to please have a round of applause for him. Guys, सारियां बसती रहनी चाहिए. I don't think it's time to stop the claps. बस इतना ही जोश है हमारे बच्चों में. Really? Please have a round of applause. Thank you so much. I would hand over this mic to Mr. Ashish Mathur sir. So please have a round of applause for him.
Thank you, Isha. Thanks a lot. And it's a pleasure and a privilege to share the dais with such a distinguished personality, Dr. Ali Irani. I think we know him very well. Those who are from physiotherapy, they know he is the vanguard of physiotherapy. And those who follow cricket or any other sport, they know him for the sport and the profession. Sir, a pleasure to have you here. And I think we need a big round of applause for our guest today, Professor Dr. Ali Irani, sir. Sir, Coffee with Ali Irani. We took this from something and we wanted to do something different for physiotherapy. We have been organizing seminars and sessions for all different fields. So for medical, our Vice Chancellor has started Living Legends of Medicine. We have a League of Innovators. And then those who are out of league, those are outliers, we have coffee with them. So it's a pleasure to have coffee with you. And I think we'll have a wonderful session. All the audience are just waiting for you to tell about what you are, about your history, about your future plans, and more so about your experiences in life. So, the first thing, sir, if with your permission, if I can start. Please. Yeah, sure.
Good evening, everybody. Thank you, Ashish. I thought I'm having coffee with two people, but I think so your Vice Chancellor, Dr. Mishra, is keeping away, or he will be part of it when he's talking.
Can we have a chair, please? Sir,
I know it's a very long day today. You all must have started long back, and almost Jaipur is it was a surprise for me. First time coming to NIMS, but it was full of surprises. Good campus, lovely campus, very rare to see. I have almost been to all the universities in India and abroad, but I really look forward this zone having Rajasthan having such a lovely campus. I have been to Jaipur, I have been to Jodhpur, and then JNDU, one of the old universities in Amritsar, then lovely university. So going to South now, most of the places that I've been, but a lovely campus. I hope, and always I look at the college in the number of beds of the hospital. So you should understand, if there are 1400 beds, that means there are patients. Right? We run physiotherapy colleges where there is no hospital. They just go to some nursing home, they have an OPD outside. This is how it is, but you all are lucky enough if you all are with this great hospital and with 1400 beds and many specialties coming. I'm open to any of your questions, other than he has a long list of questions for me. Other than that, you all can, I think so, write down any questions, send it here, definitely, so Ashish will read it and I will answer. I'm like a postcard, so don't worry. Sometimes I don't want to name people, so I won't be naming them. Otherwise, whatever it is, it will be answered. Right? Thank you. I'm ready, sir.
Yeah, so welcome everybody for this session. And we generally do living legends, and we will do living legends with him as well. But this time, we wanted to be a bit informal with him, and with kind of his flowery personality, if I may so say. I thought this will be a better kind of introduction of him to you and to us. and to all those who are witnessing this particular event. I mean, knowing him a bit by the kind of folklore, because every time the cricketing and Bollywood, and he remains in news page 3 kind of personality. So I thought this is a better introduction to him. So we thought of this informal sort of gathering where everybody is, and I mean, initially we thought that we will have some things, whatever you want to know on chits written and presented to him. But Dr. Irani said that no, it doesn't matter, whatever anybody asks, he is quite open to answer everything and anything under the sun and also the moon. So, so with this kind of go ahead from him, we thought we will just be a bit informal and ask all those questions. I know you have a lot of questions in your mind, and just to say, he's a kind of role model to all of us. I mean, we doctors, physiotherapists, and all those who are connected with medical fraternity, he's kind of role model to all of us, and I'm sure many of you would like to become like him. And so I think that is the thing that we are looking, and he will relate to you a lot of anecdotes he has had. I would request he should at least give some names, because that will give the context to all that is happening. Those, I mean, where these things are, issues are not a issue at all, he can name them, but otherwise he can maintain confidentiality. So with this, I think
But sir, I think Irani said nothing is confidential as such. Everything is there.
His life
is an open book, so taking names, not taking them, we'll understand, the clues will be giving us. So sir, the role model you are, the icon you are in the field of physiotherapy. My first question would be, what made you choose this profession? Why physiotherapy?
I wanted to be a pilot.
Pilot.
I said I was working in Nanavati Hospital canteen. So when I was working there, opposite Nanavati is Bombay Flying Club. So most of the trainers used to come to the canteen, I used to serve them. And I started asking them everything about the details about flying and how I can become one. So they told me, don't worry, within 8 months we'll make you a pilot, 6 months you'll be student pilot license, 8 months you will be having your... So they went on explaining me, so I was very keen. I told my dad, I'm going to be working towards being a pilot. And then I was in 12th standard, 2 things happened. So as a 12th standard science student in Bhavan's College, Mumbai, I used to captain the football team. So again, the history, I never played cricket, but I was the captain of football and landed up in cricket. So when I got injured, I went to Nanavati Hospital Physiotherapy Department, Dr. Anand Joshi, very senior, God bless his soul, he is no more there now. He saw my knee and he said, okay, the problem is that we don't have a sports physiotherapist in India. So yours is a sports injury. So that was my first trick. Something has to be done. 2, it was a month of Ramzan and I read my Quran in English. So I was reading in English because I didn't know Arabic. So there's a phrase, those who know and those who are reading it, I would say Surah Ma'idah, verse number 32. It very clearly says, God says, if you heal one of my human being, you have healed my mankind. So that struck me very hard. So why should I not select a profession where I will be a healer? So I will go and heal, and God has accepted. If you heal one of my human beings, I will consider that you heal my mankind. So night I discussed with my dad. I said, okay, now I'm off flying, and I'm going to appear for the lot of entrance exams. So finally I got selected in Delhi, did 2 months in AIMS, and after that the ad came from Baroda. There were 7 physiotherapy colleges in India. There was Mumbai, Nagpur, Delhi, Vellore, Chennai, Calcutta, Baroda. Baroda was the only one giving degree, rest all were diplomas. So I went to crack that exam in Baroda, And thank God that time there were always the exams are 2 ways, you have to write and there were interviews. So they were more interested in the interview, how you fare and what you do. And 20 seats, all the 7 colleges had 20 seats. So you have only 140 seats for the whole country. So in Baroda, next day morning I saw my name on the top, so immediately paid the fees. And I said, now Baroda is going to be, because it's a degree course. So I preferred degree. But yes, as things went, by the time I was in second year of physiotherapy, people in Baroda knew me as Ali Physio. So maybe one, I was captaining our medical college football team. 2, I was playing for Baroda district. 3, I thought of fighting an election, which is called FR, faculty representative. So imagine the one side all the MBBS students, and other side 20 in each year. So with 85 students from physiotherapy, I wanted to fight a post for FR. Thank God I won that election, so became famous in the university. So a lot of strikes of 1978, 79, 80. There were a lot of strikes in Baroda, and that Andolan was also there. In that, I was leading and we were successful. So from there, when I came back, started Bombay Hospital. I was in All India Institute also for the short program of postgraduate diploma in rehabilitation, but I was thrown out of there within 2 months because anyhow, they didn't like me, the people who were there. So from there, I went to Bombay Hospital, started my research program, and then destiny took me from Bombay Hospital. I was supposed to treat the chairman of Nanavati Hospital. So when I went to his house and he became okay in the next 3-4 days, he asked me, okay, what are you, from where you belong, where you were born. So I told him that I was born in Nanavati Hospital, I was brought up in Nanavati Hospital, I have been working in Nanavati Hospital in your canteen. So he said, then what the hell you are doing in Bombay Hospital? So you should be back to Nanavati Hospital. That's how I got. And within a month, now when I was in Bombay Hospital, my 7 o'clock to 9 o'clock, 7:30 to 9:30 slot was for sports people. So it was a big physiotherapy department, God bless Dr. Ramai Patel. I've learned a lot from him. He's no more again. But I remember the last 2 months, every Saturday, Sunday, I used to fly to Ahmedabad because we were not doing well. He had cancer and everybody knew he's just. So just wanted to grasp whatever knowledge he had. So every Saturday, Sunday, I was with him in Ahmedabad. I learned a lot from him. And when I came out to Nanavati, it was hardly within maybe 15 days. So I was treating a lot of Hanuman Singh, or the chairman of the selection committee for cricket. He's from Dungarpur. Then Polly Umbriger. I was treating most of the sportsmen, athletes, football, because Bombay Hospital is close to all the grounds, football ground, cricket ground, athletic ground. So I was treating them. So Hanuman Singh told me, you are at the wrong place. He says, Indian cricket team needs you. So when I applied, suddenly 50 people had given applications. So from 54 were selected. From 4-3 orthopedic surgeon Dr. Kannan from Chennai, then Dr. Rajgopal from Delhi, Dr. Anand Joshi from Mumbai, and I was the only physio. So I still thought, okay, maybe no chance. So from 4 they decided on 2. So when they made 2 was Dr. Anand Joshi and me. So Anil Amani said, okay, both can go, I will pay for both. But ICC rules said only one can go. So again, new interview for both, and we both were friends. So I went and praised him, he's good, he has come from US, he does arthroscopy, he knows everything. I didn't know when he went in, he told Polly Umbriger for the final interview, I am a surgeon. If you want something to happen on the ground, he should be going. That's how I came into Indian cricket. Being the first physio in any sports team of the country, a lot of responsibility was there. If you are successful, then you are part of all the sports. And if I was not successful, then I don't know whether they would ever want it. That 7 physiotherapy college wouldn't have become 8 also. So being on the ground, being there, everything changed. I think the destiny of physiotherapists changed. Like many of the seniors tell me, we did physiotherapy, seeing you running on the ground. Many people say, I have Dr. Nagaraj, he's an arthroscopist from our hospital. Dr. Nagaraj. The best thing is, he said, I have treated him when he was an athlete. I have taken care of all his injuries. So he says, I went and did orthopedic surgery, seeing you, and I went and did arthroscopy so I can do all the knee repairs. Then first time when he entered Nanavati, he came to meet me. He said, I am joining Nanavati because of you. So that's
Very, okay. So great, sir. Nice to know how you got in the Indian cricket team. But yes, maybe it's a loss for airlines, but it's a gain for the Indian physiotherapists. And though you could not become a pilot, but you are flying higher than what the pilots fly. A big round of applause for the physiotherapists of the cricket team. So my next question you already answered that you have been with Indian cricket for 10 years. You have watched each player very closely. I think from Gavaskar to Virat Kohli, you have worked with everybody of them. And you have been with the Fab Four, which are called Fabulous Four of Indian cricket, the Tendulkar, Ganguly, Dravid and Lakshman. First thing, what do you think, what makes them different from others? It's not related to physiotherapy, but what makes these people different from others?
I feel it's fire in the belly. I've always seen the successful people have to be grinded. You know, if you know the story of a diamond, it's a charcoal. They remove it, it's like a coal. But enough grinding on it, enough polishing on it becomes a diamond. And some of the time, diamonds are turned into solitaire. So some become a solitaire, but rest are diamond. So in cricket also, I've seen all of them have gone through tough time. The way they have got going for practice. I was talking to you all during lunch. I was talking to a chairman. I was saying I was seeing like one of our players cycling going for practice, and during practice he had his nose bleeding. So the coach could only say, "Go back home." So he had to cycle down from Shivaji Park coming to Bandra with the nose bleeding. But these are the things which give the fire. You know, I'm not going to live. That makes them tough. But we had players, you won't believe. I've seen players, if there are servants to put the pads on.
Is it?
There are the people who put the pads on. He will do like that so the gloves comes. And when they have gone to the next, when they come back, they will do this, somebody will remove the. But I don't think so they've reached anyway. Okay. So there should be a fire, and I'm sure all of you all, it's hard work. Please, the simplest example I can give you all for your success, don't think what you will make. Right? If I'm standing here, if I try to chase my shadow, I can't catch it. But if I turn away, the shadow will follow me. Right? So please, most of you all are thinking what you will earn. Right? So money will follow you only if you are dedicated to your work. Mumbai hospital, my salary was 600 rupees a month, my lowest pay. Right? And highest pay I got is 1,75,000 rupees per one day match. So we are not people to be employed. I feel every physiotherapist within himself or herself is a consultant. When I was taking 60 rupees for private patients, 60 rupees was home visit, I knew a lady who was taking 3,000 rupees. 60 rupees was we were taking. She should charge 3,000 to evaluate her patient. Right? So these are the things that gives you the head. I said I'll cross her target. Right? Anyhow, I don't do home visits. I don't go home. Right? But the offer makes me feel very nice when they say, what do you want? आप घर के आके हमारा पेशेंट देखो कितना चाहिए आप. So it feels nice when that is told you what you can get. So please remember this shadow. If you chase the shadow, it will keep going ahead. But if you turn back and dedicate your work, I never thought about what I will earn. Never bothered me also. Right? I only knew that I am there to heal. So maybe if I heal, the rest God has to do. Right? So have that fire in your belly. So most of these cricketers, initially when they come from a place which is, from villages, I can say, small town, they have not seen, right, where they have not seen a Western toilet. The first thing I had to teach them is to how to sit on it. Because they used to go and sit over it and fall, and first they used to sit and injured. Right? But they have the fire in the belly. And that's how they become. They work hard. I've seen a spinner practicing for 4 to 5 hours a day. One single stump and a kerchief. So the ball, when he used to bowl, he used to hit the kerchief and the stump, single stump.
Single stump.
Yes. And then he played for India, made a world record at Chennai, if you remember, against West Indies. 16 wickets.
16.
So it was a world record.
Narendra Irani?
Yes.
Okay. So that was it. If we get the clue, we might be knowing the names. Okay. Thank you, sir. So it's the fire in the belly which separates you from others. I think great, sir, great. And sir, in the initial days, if I talk of 80s, when we won the World Cup and we came back, and after that, there was a revolution in cricket as such. The whole cricket dancing matches and everything happened. But Indian cricket team was used to be very bad in fielding, so they were called laggards. They were lazy enough to chase a ball, to make singles into doubles. So what changed? Means I think your contribution has to be immense in that.
Our problem was there was nothing like warming up. Even the car, those who are riding a two-wheeler or a four-wheeler, when you start it, you raise it. That raise is the warming up of the vehicle. So that system was not there. So when I joined them, first thing is there will be 45 minutes of warming up. So warm up, if you warm up, more blood supply goes to your muscles and the tissues. And once that will allow you to stretch more. So there was a warming up program, there was a stretching program. And then as we were playing test, I used to have a cool down program. And cool down program was half the time of warming up. So if you were warming up for 45 minutes, at least 20 minutes I used to allow them to cool down. Cool down was more on the floor, joking, and we were saying mistakes of each other and teasing them and all that. So that was taken in a very light way. So that system coming in me. Then after I could conquer that, in 88 I could start pushing them for gym to do weight training, which is very important.
Nobody saw the gym.
See, it was rare if you see before 87 people hitting sixes. Very rare. We had studied Irani who could hit six anytime. Others didn't have that strength. They didn't have the power to clear the rope. So we started strengthening the shoulder. So whenever they hit, we were sure it will be outside.
Oh, that created the difference, I think. Now I think Indian cricket team is very fit. So my next question is that one. Whom do you think is the fittest cricketer of India till date and also of the world? The fittest?
No, I talk about India. I think so Kapil Dev was the fittest.
Kapil Dev was. He never missed a match, I suppose. He has a record.
No, he trained twice. When we were training in Delhi, our training program was 8 o'clock. So 6 o'clock we used to train with the hockey team, and as soon as we learn, he should continue with us.
Okay.
So,
so that's the fire in the belly.
I heard you should just run whenever, once a week you should just go for a marathon. You should run, keep running in the car, you should follow it.
Okay.
I believe hockey would be a more strenuous activity. Or what is it, football?
See, we have never played on turf. We have always played on ground. But hockey players, they have to be used to the turf. So I think so the exercise is also tough. But he could finish with them and join us.
Okay. So he trained double. And about the world cricket, if you can name somebody whom you think was also in everybody.
There's a very big definition.
Okay.
I feel in cricket, the definition for a fast bowler fitness will be different, a wicket keeper will be different, a fielder would be different. If you have seen Jordy Rhodes' one picture in CCI, was playing in Brahman Stadium, you will find him like this. And he had taken that catch.
Sachin's catch?
Parallel to the ground. I don't know, but that was one of the World Cup matches. So I think so, in fielding, nobody can beat him as far as fitness is concerned.
Okay.
So fitness becomes, or a person who can stand for 200 runs.
Yes.
So it's not that nobody can get you out. You get tired. Most of the players, I feel they get tired and they want to come out. So it's a or something.
Yes, well said. But there are players like Sehwag who don't run much. They just hit fours and sixes and they cross 300 runs. And he has done it twice.
One of very senior cricketers, when he was just thinking of retiring. So I told him, you can see a cricket ball like a football. You can bang it anywhere. He said, no, that's not my problem. My problem is when I have to take runs. By the time I have taken 2 runs, my opposition has taken 3 runs. The other side.
The other side.
So that embarrasses me.
Okay.
And he used to stand at the slips. He said, if I miss the ball, he said there are 8 cameras showing me how fast I can run. So that embarrasses me. So it was not hitting the ball, but chasing the ball or taking the run in between. He said that's why I want to do that.
So in addition to cricket, sir, you are also physiotherapist. You have done it for many Bollywood celebrities, I think. And cricketers and Bollywood stars are revered equally in India. Can you share some anecdotes of cricketers? How do these superstars behave so that our budding physiotherapists can just understand their psyche and they can work accordingly?
No,
What is the key one thing when you treat a star? What should you keep in mind? So if somebody walks in NIMS University and he needs a treatment, so
they are abnormal.
they are abnormal. Okay.
They cannot take any injury, telling them they will never play again. Same thing, stars and cricketers and in sports, or they are same. Once they become a celebrity, it makes a lot of difference to them. But I remember after we started all this in cricket, there were 2 young upcoming stars, and they had made a gym in the house, and they used to hire me, come and see me when we were doing the gymming. And so I still remember, I just met them during this iftar party, both of them. The videos were very viral on social media. And I was ignoring them, I was just standing. There's a famous politician, Baba Siddiqui, he holds iftar party, which is very famous in Bombay, at Taj Hotel, Bandra. So when they came to the pass and suddenly they saw me, so they came back and hugged me and all that. So it's that because I helped them to start doing gymming. Nobody had the knowledge about. None of our earlier stars were doing any of the stunts. They had the people to run for them, so they were showing all the backside. But the new stars that you see, it's good for physiotherapists. They are more injured because they want to do the stunt. Right? So most of the injuries are they wanting to do the stunt because they want when people are whistling, we should feel nice that I have done it. Right? So we had lost one of the stars on helicopter. He wanted to jump, same opposite Nanavati Hospital. So when you jump, you have to fall on the airbag or the cardboards. So he didn't know the exact timing. So by the time he left himself, the helicopter had shifted. So instead of the cardboard, he landed on the ground. Multiple fractures. 6 months he was, 5.5 months he was in Nanavati Hospital. Multiple fractures. So now they want to do stunts, so fine. And then they started having that concept of gym karna. And we have seen most of the stars. Earlier stars will never be in half shirt to show their biceps. But nowadays the stars will wear sleeveless to show that they have been doing gymming and all that. But I remember very well one of the stars telling me, okay, the acting is from here.
Yeah.
Right? So your face has to be expressive to do the acting, not your body. So anyhow, maybe I'm close to them. They all come. My hospital is situated in such a place, Nanavati Hospital. So in Jew area where most of the stars say. So any injury they come and then one tells the other one like that. And then knowing which sport, so they feel the injuries are same. Either they get injured in the gym, they get injured by hitting. I remember one of the stars trying to jump from the 4th floor, but there was an airbag. But not knowing the pressure of the airbag, when he jumped on the airbag, he went back again 4th floor and 4-5 times he went on banging. So he got a whiplash. So we were treating him for almost a month. Right? So there has to be technical people because I was not the person to know how much air he should have in the airbag. I came to know when he was jumping. But after that, most of the stars, now also even TV stars, all the live shows that they were seeing, there are 1 or 2 physiotherapists always there. So we have found our place in all the reality shows, in all the serials, and all the films that are happening in Bollywood. If there is a fight scene, chasing, songs, right? So I remember one of the heroine had got ankle sprain while they were doing a song in Mud Island. So from 3 o'clock I started getting call, Aja, we want to complete the movie, the song. She's refusing to walk. So at around 5:30 I went there, just did taping. And I said, continue. So suddenly I saw, it was a Bhojpuri movie. I saw her tied around a coconut tree. So I said, Bhojpuri picture mein nariyal kahan se aayega? So they again removed him mango trees. And you all know, those were watched Bhojpuri movies. So after the scene was over, they said, cut. Red scene. So I took my bag. He said, कहाँ जा रहा है? I said, नहीं मैं उसको रेप होता हुआ नहीं देख सकता. So it is, they get injured, so they want you to continue. Right? So, and most of them, whether they are directors, producers, somehow they were my patient. Now it's 35 years I'm in Nanavati Hospital. Born there, brought up there, I don't know how many years I'm going to be there with the hospitals. And I believe working at one place. So I go early morning, 7 o'clock, 7:30, I go there and there till late night. Whoever wants to meet me comes there. So earlier at one time my proposal was from Bombay Hospital. It was supposed to be 7:30 to 11 o'clock. 11 o'clock I was supposed to go to Hinduja Hospital, 11 to 1, 2 to 4 Leelavati, and 4 onwards till 8 o'clock Nanavati. So one day I just took a decision. I told my chairman, buy me off. I don't want to go to so many places. So he says, what do you want? I said, I will do the department the way I want. Right? And hardly there were 6-7 patients they were seeing. Today we see 300 patients. Right? So we were the one who started night duties. So our relationship with doctors improved during night duties. So please, all the principals who are there, please send your final year students, your interns to do night duties. Your relationship with the hospital and the doctor improves. Right? So we do night duties, we do holiday duties, we do Sunday duties. And my students, especially the MPT students, there are a lot of interns that come. I don't know whether your college will allow your students to come. I would prefer, if the students come, they should come for 4 months, 5 months, but come back to your university and teach those who have not been able to come to Mumbai. So whatever techniques they have learned, they should give it back to your students. This is what I prefer. I have given quotas. I give quotas to Guwahati. I do it for Rajasthan. I do it for Jammu, because people who are far away, I want them to come and learn and go back to the city. So we are consultant. Each one can't see more than 10 patients a day. Right? So even if you have 5, you have a luxury life. Right? If you have 10, then you are too good. Right? And you prove yourself. And people will come, they will chase you. Initially not. I started with 4 or 5 patients a day. Today is 300 and we stop at 300. It's not that we don't have much more patients. We don't give appointment after 300. Right? And working, so we are 24/7. Right? More than 110 physiotherapists working in a department. It's huge. And our connection with all the surgeons. You talk about cardiac surgeon, ortho surgeon, joint replacement, they come, they discuss what they want. We follow their, whatever way they want their patient to be treated. And 24/7. There won't be a complaint to your physios didn't come to treat. They will be there. Including all the sports team in Bombay. Wherever there is sports events happening, they tell us somebody is there. Because we have MPT in sports also. So people, you have to skill yourself.
Yes, very good, sir. And the key word here, students, is buy me off. If you reach at that level, skill yourself till you can say these 3 words. Buy me off. मुझे खरीद के दिखा दो. जितना मांगता हूँ उतना दे के दिखा दो. Hats off to you. Big round of applause for Dr. Ali Rani sir. Buy me off. Nice word. And I think the future is bright for physiotherapy, because all these stars, as you have said, are doing action. They need a physiotherapist on the sets. They might have their own team also.
This morning I was saying India needs 2 lakh physiotherapists. But our problem is 80% of the physiotherapists are female. So we give degree, but they go after the DICRA. They go for
DICRA.
So they get and forget physiotherapy.
DICRA is okay, but degree भी चलना चाहिए ना. You need to practice it. वरना 2 लाख आएंगे कहाँ से?
So many of them will do it. So our registered physiotherapists are almost 60,000, but I feel the practicing physiotherapists in India are 20,000, because almost 7,000 are in USA, more than 1,000 are in UK.
Okay.
We have more than 600, 700 in Australia, another 200 in New Zealand, Singapore, Maldives, everywhere there are physiotherapists all over the country. So we have lost almost, I could say, 15,000 physiotherapists to other countries, Europe countries. But so maybe 20,000 are practicing in India, and we need 2 lakhs. So we are 110.
Look at
Till
the
2 lakh
future.
I don't fear. Till when they say there are 2 lakh physiotherapists in India, I don't fear. Everybody has work.
Everybody has work, but they need to skill themselves. I think
That's super specialty. Many
that is
more specialties
many
will
more
come.
specialty.
So that was my next question. Do you have like super specialization in physiotherapy? So somebody after doing the course, does he get a specialty, let us say chest physiotherapy, post cabbage kind of thing, or like orthopedic specialization, or things like
So
that?
I will just say, initially, I'm talking about MBBS, then coming to physiotherapist. So everything was MBBS. Believe me, the older MBBS people also were dentists. They used to see the 3,000. Everything, they could do delivery also. Then specialty came divided into two. It came surgery and medicine. Then medicine subdivided into pediatrician, neurology, psychiatry, it went on. Surgeon became neurosurgeon, orthosurgeon. Orthosurgeon subdivided into knee specialist, hip specialist, spine specialist, shoulder specialist, then arthroscopy came. So with event of time, there was, I remember when MPT started, master's degree started in physiotherapy, it was general. So you are BPT or you are MPT. Then we thought of MPT because by that time I was in a lot of committee of making syllabus. We decided into two, right? So we went for orthopedic and neurology. We never knew how good we will be in cardio. So cardio came next. Then community-based rehabilitation came. Then sports medicine was started by JNU. Right? And I think so now a lot of people, if you don't know, a lot of people are doing pelvic floor. So many of our problems in this world has to do with pelvic floor. Started by one of our very senior therapists was in USM. He has written a book also. Right. So I'm sure that pelvic floor will become again a specialty. People will take that. But what we do, sir, in our MPT program, I've taken a bigger umbrella. I don't call it orthopedic. My specialty MPT will be in MSK, musculoskeletal. So musculoskeletal, you can select your thesis, joint replacement, manipulation, mobilization, spine, joint, only super specialty, they want to only do knee replacement. Because many surgeons do knee replacement. So you should understand, you have enough patients. Every day you can go and see 10 knee cases done by the doctor and he will keep referring to you. So in super specialty, many will come. I said the same thing, maybe we have prenatal, postnatal. One of my staff has gone and started in Delhi, Mahima. She's written a book also on parenting. So she's enough patients she has. And she doesn't take more than 8 patients a day. Said I have to give 45 minutes to all each patient. So she even teaches the woman how to become a mother. What are the precautions you have to take? When are you ready to be a mother? Then throughout the pregnancy, they teaches which exercise to be done, which muscles to be strengthened. So it itself has become a specialty, women's health. So I think tomorrow some airline will start. They will also keep a physio on the flight. So to keep the comfort of the patients.
Comfort is more important nowadays. Great, great. Thank you, sir. Moving from physiotherapy to another facet of your personality, the Cafe Irani Chai. Cafe Irani Chai, which is a documentary made for Irani Chaiwalas in Muscat, and you have been a producer of the documentary. And in fact, that is a documentary which has won the highest number of awards ever in India. Big round of applause for the documentary Cafe Irani Chai. So, sir, how did you thought of producing it and what it is all about?
I said my life was after school coming back home, doing my homework, at 4 o'clock I had to be working in the Narmati hospital canteen. So making chai, and my chai to be ready to please come to Mumbai. There's another chai that I make with my hand and I give it to my guests. It's quite famous. And I saw all the Irani restaurants fading away. So Iranis which came from Iran, that time there was no Pakistan. So it was Iran, border was India. And our train from Mumbai was going straight up to Iran, a place called Zahedan. So many people who migrated and came to India, this was before the Second World War, before our independence. So when they came here, they had nothing to know, so they were making. So my father also came at that time, some 90 years back, started a restaurant in Mumbai. At one time, he had 14 restaurants in Mumbai. But it was chai. The chai, the bun maska, omelette, whatever they could make. So I thought that restaurants were fading away. So I said, why not document it? So I started shooting in Hyderabad, Pune, Mumbai. These 3 cities I have taken full of Irani restaurants. Now from there also, believe me, I started almost 6 years back. 50% of them have closed down. So hardly any 50% of the restaurants are left.
Okay.
So my thing was, there was another interesting, you will find it later. There's another documentary I made. It's called Khane Baluch, the Gypsies. Yes, Gypsies. So when the Mughals, the history is when the Mughals wanted to invade India, when they used to come. So they didn't have enough army. So on the way, whenever they saw any gypsies, they used to bring them to India to show a big crowd. And they used to loot India and go away. Like Muhammad Tughlaq used to every time come, let the gypsies loot up to Mount Abu, the temples. And they used to go back. So these gypsies are in India. There are 3.5 lakh, they are called Khane Baluch, gypsies. 3.5 lakh in India. You'll find them somewhere near Patna. I'd identified them, I've shot them. Pune, Shivaji Nagar, Hubli, Chennai, Calcutta. These are the places we went and shot. So maybe that documentary will also come soon. I love keeping that this will remain because our next generation won't know that they were there. But I think you see they were brought for some other purpose. They have left here, they have made India as a country. So you will see blue eyes. Most of them in this Bombay Pune road, they are selling helmets, they sell goggles and glasses. This is not in Bhopal also. I'm living in Bhopal.
Okay.
Yeah.
Even in Rajasthan actually. So
Yeah,
even in Rajasthan there are a lot of gypsies, and as a matter of fact, gypsies start from Romania. And they
All they were all
and they're from Romania till India. They were all over the place. They were scattered, and they used to take those caravans and go all over the place. In India, in Rajasthan actually they have called I forget the name, but there is a tribe, and they sing beautiful songs. I'm sure all the
Sir, evening
they were
they
singing and
don't have
dancing.
mobile. Evenings they are trading. He says, I've got one horse, he will take 4 goats for that horse. Then he says, 1 goat, some 10 chickens. They trade amongst each other. And next day maybe the cattle will come back to them. So that time pass is trading of cattle amongst each other.
Yeah, Rabaris, Rajasthan.
I've done some 32 hours of shooting with this Khane Baluch. And the best part was I was asking one of them, okay, what are your profession, right? So he says picking pockets, pickpocketing, looting. So they thought it's a profession.
Profession, okay, okay. Very nice, very nice. Great job, great job. And India has 2 famous Iranis, one is you and one is Boman. Have you thought anytime entering Bollywood? Because you have all the connections.
We are very close friends.
So,
I have done, Majid did a movie with Ishan Thakkar called Beyond the Clouds.
Beyond the Clouds.
So I've done a role of the doctor who was an examines the patient.
Mm-hmm.
I get a lot of offers from my friends who are all in film industry. But I prefer something where there will be a physiotherapy. There was another movie made, Angel. Movie's name was Angel. The role was the girl makes an accident and requires only physiotherapy. So it was shot in our department. So almost 15 days we were shooting.
Okay.
And throughout a role of a physiotherapist is shown in that.
Okay.
So then I've done another, that movie is not released here, it's an international movie, Salam Mumbai. So a bigger role, I was a professor in there and then treating patients.
Oh, great, great. So, sir has the exposure to Bollywood also. Put an applause for the superstar, Dr. Ali Irani, sir. Great, sir, great. And would like to demonstrate something, I think, the Chamatkar and all those.
Many youngsters talk. I want to only tell you, okay, when you are treating patient in India, the rule is like that. Chamatkar ka namaskar hota hai. So on the day 1, if you can't show any result to your patient, don't expect your patient coming the next day. So some of your techniques should be such where the results are immediate. So I thought one of the things that I do, those who can't touch their toes, if you are standing and you can't touch the toes, 2 of you can come here. I won't touch you all also, and we will show an increase in your range. So when
So
you
2 volunteers who can't touch your toes, तुम भी नहीं पकड़ सकते हो? Oh, he's going on. 2 volunteers, students, those who can't touch your toes, आइए. Oh, the faculties can also come. ऐसे.
those who can come till here, I will see that you come.
From the first floor, if anybody wants to volunteer, please, आइए. We'll have some. You cannot touch your toe, my dear. You can do it. जाओ. Remove your shoes. चलो. Thank you. चलिए आप जाइए. Good. हो गया भाई, हो गया. We needed only 2.
जो टच नहीं कर सकता है,
जो टच नहीं कर सकते हैं कृपया यहाँ आ जाइए. इसमें कोई, अरे पता है बेटा, योगा करते हो तो. जो कर नहीं सकते, can we call the principal?
Okay. Sure. Okay.
Where is the principal of physiotherapy?
This was.
Anchit ji, आइए ना, आइए. Sir, there are 2 people. I tell you, there are 2 people.
one is Dr. Anchit and one is Ashish Mathur.
We are on picture. Can you do now?
I cannot, I missed.
How much you can do?
I'm not sure.
Good. So at least they know. I'll see that it increases. Right? So I'll take. Two. Okay. This was a research done. I used to spend 10 to 12 minutes on each cricketer to release the hamstring before they could bowl or before they could go in bat. It was a long process. Then I found a point, a fascia, if I stimulate that, I used to get faster results. Then finally I came to, okay, why should I waste? You have to take a pen, ball pen, and keep kneading that place. Okay? So then we came with an idea to make the player stand on a marble for 2 minutes. So you are going to time them for 2 minutes. I won't take more than 2 minutes. You all know how much. Sir, can you go remove your shoes? You go face them. Face them. Okay, go down. Fine. Okay. So you all know well. So I'm going to keep it exactly there. Right? Okay, good. Fine. Take body weight both. Time in, please. Sister. Fine. Good. No. Yeah, no. The initial 20 seconds are painful. We are stimulating fascia. I don't want to talk more about fascia. Fascia is a network of our body, it's interlinked. Right? So I think so. One of the workshops yesterday was IS that was there. So it's related to that. So any fascia you catch up in the body, if you can stimulate it, you get results. So this is for hamstring. I use it on all the back problems. So if you release the hamstring, the patients feel better. I hope somebody's keeping the time. 30 seconds. Fine. So both are 30 seconds.
5 seconds.
Yes, sir. 5 seconds less. They keep talking. So you don't need to spend 10-12 minutes on your patients. So before you're treating your patient, I just ask them to stand on the marble. And then after 2 minutes, you will see the results. So 1 minute. So you have just 1 more minute go. The next thing that I want to show you all is more than 85% of the people have neck problem. How to test it? When you take the neck forward, chin back, it's no pain. But when you push it back, it's painful. Right? More than all Indians. We have done the study twice in Bombay, got up people from outside the railway station also, and we found they had neck problem. And then looking to the right and left won't be same, depending on how much of mobile we use. Right? So the other patient, I say it's bread and butter with jam for a physiotherapist is treating a neck problem. The patient gets addicted, they will keep coming to you, not every day, but off and on they will get neck pain and they will come to you. Right? So again what to do, maybe after this I'll demonstrate that this technique is very important. If you are learning, start going and doing it for your parents at home. Right? They will be very happy with you. Right? They are feeling much better. 2 minutes. So you leave, just come out. Okay, touch. Step out. Marble is yours. Right? So I say in India, चमत्कार का नमस्कार होता है. What to do when? I always tell a story. A ship was not working. A ship. So a lot of engineers came and they gave quotation and they could not repair it. They got a person who said, I'm going to repair this and I'm going to charge you 10,000 rupees. They said, we have spent lakhs of rupees and the ship didn't start. So he says, 10,000, he says, done. He said, get me a hammer. So he banged the hammer 3-4 times at a particular place and the ship started. So he said, hitting hammer you want 10,000 rupees, you have not done anything for 100 rupees also. He said, see, my hitting the hammer was 100 rupees only. Where to hit was 9,900. So where to keep the marble is important. Right? Otherwise if you do this, no patient is going to pay you. So कुछ किया ही नहीं. Right? We do manual therapy, patients are not happy. So because our patient needs, some of the patients are like that. Even if you give them diathermy, they feel कि ज़्यादा लेगा तो अच्छा बढ़ाओ. Finally they will come up with burns. You give them SSR short circuit current, बढ़ाओ. They think they are paying money, so ज़्यादा लेंगे चलो ले लो. Right? So how much you take, where to give the treatment, that's the important part. So if any questions are there, I come, or I want to show the neck demonstration also. So you can start at least treating your parents at home.
So any neck demonstration, you need some volunteer?
I will need anybody with any neck problem.
Yeah, please. Please come.
Come.
Come, bachcha. Come. Aajo.
Which sport do you think is the safest, with the least injuries? And which sport?
With
And
least
which we
Can
can
we have-
recommend for our university?
Can we have chair, please, for sir? We need some chair.
The municipal commissioner of Bombay don't allow any buildings to come without a swimming pool. Swimming is one of the best exercise. See, when you walk, only your quadriceps is working, lower extremity. When you swim, it is double the calories you are burning. It's 2.5 times more. So your upper arm is working, lower extremity is working, and the spine is rotating. And you get corrected. I always give a reason. You get up in the morning, you brush, you are bending forward. Then you are working, you are cooking, you are driving, you are riding, right? And then come and sit on the sofa at night to watch TV, and then you cuddle and sleep at night, either on your right side or left side. So the spine never does any extension, right? That's why Surya Namaskar was made. Right? We forgot 7,000 years back. Right? So you have to unwind yourself. So I have made a shortcut for it. All of us has to be in this position half an hour morning and half an hour in the evening, just to unwind. So when you are lying in this position, your thoracic gets the extension. Right? And all the back problem you will see that there is no extension in the thoracic. So they are overusing the lumbar. So it's like lifting a bag with your hand. You can. But the same bag with the finger you can't lift. Because all the load is on the finger. So please understand the back load has to be taken by thoracic also. So if your thoracic has gone in flexion, you are not taking any load. So that's why I feel Surya Namaskar 7,000 years back said, get up early morning, get ready, go outside the house, face the sun, do your mantras till the first ray of sun falls on you. 3,000 years back, Moses said, go to the Vedic wall early morning. Your health and wealth I shall protect. That's why Jews are the richest. 2,000 years back, Jesus came, said the first mass is better than sitting in the church the whole day. And 1,400 years back, Prophet Muhammad came and kept the morning azan. Right? So Australia went after it. In all the 7,000 years till now, there are two things common. Early morning, outside the house.
Okay.
And then the theory of ozone came. So Australia proved 1 hour 20 minutes before sunrise, the universe releases an ozone which is very, very, very good for your health. Right. Studies went further and it proved that there is no animal or bird in the world that doesn't get up 1.5 hours. So they understand ozone better than human beings. right? So I'm not telling it for the Jaipur youngsters. Mumbai, all the youngsters come home after breathing the ozone.
So in which ways they breathe the ozone?
They breathe the ozone and then they come
Then they
home.
come back.
So please understand what science says. My students have done a study, 1,000 morning walkers, 1,000 evening walkers. All the morning walkers were healthier than evening walkers because of that ozone. So don't say any religion asking you to get up in the morning. You want to be healthy, get up in the morning. Again, the best exercise sports, you want to do swimming. I've never seen a swimmer. Otters Club, Khar Gymkhana, the best swimmers of countries are from these two clubs. Never seen a patient, 35 years. Swimmer is not a, their injury, you can't do anything. They get drowned, you can't do anything. So they won't come for physiotherapy. So best sports today is correction, right? What we said. Again this year a student is doing a study, morning walker when? So morning before sunrise walker and after sunrise walker. So if you have a pet at home, cat or dog, leave the door open. Exactly 1.5 hours before sunrise they will go out. Whatever reason you want to give, you give. If the bird is at your home, keep the window open. They feel the ozone. As soon as they feel the ozone, they will start chirping. So they understand ozone better than human beings. But we want to get up a Surya Namaskar. I've seen people doing Surya Namaskar. I get up at 9 o'clock, I do Surya Namaskar. But Surya has gone where? There is screen open. You have to feel the ozone. So please, no religion wants you. Nobody needs you. Don't get up morning. God doesn't need you. God doesn't want your whatever you want to do. It's for your own health. You want to be healthy, you do it. It's only showing you the way. Right? So coming to next.
Yes, nine. So we have three in fact. Three. Sir, Salman Khan. Huh? From a scientist who became Salman. Very nice. तालियां बजाइए सर के लिए. Wow.
In low back, for me, it's very important is SLR. I see pre and after the treatment. For neck, rotation of the neck. So you're going to look on your right, just turn and see whom you can see. Can you see the guy with the camera? This one? No. Fine. So you can see the speaker there. Fine. So you can see the speaker on the right side. Can you see left? Yes, this side. You can see anybody on the first row? Which one? 1, 2, 3, how many? 5? 5. Okay. So one thing was clear, it is right and at the center. So right he could see the speaker, left he could come here. So all of us are going to have that. Right? Depending how we use our phone and how much we do and which side we sleep. Right? So it's now the techniques. I'm going to use the chin tap. Right? I'm going to use my thumb. So you will be seeing what I do and we'll see the range again. I'll move both sides, okay? So I'm just going below the skull, occipital and co-occipital joint. Just push it back. You keep pushing. See, I'm holding it, not allowing him. I'm at the transverse process. I'm at C1, push it back. Again push it, C2, come. I'm at the spinous process. Go. Push again. Push again. Push again. Push again. I'm on the spinous process. Push. Okay, now I'm going to come on the transverse process. Push. 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 Fine. Okay. You're going to look on your right again. Left.
Wait, sir, पूरा ठीक करके भेजेंगे आपको. Can you see the beautiful man sitting in the first row?
Fine. So hardly half a minute. Fine. Increase, always remember in spine, increase of range is decrease of pain. So whether the patient is happy or not or fine, we'll ask him later. Right? But you saw the increase in range, definitely the patient is feeling better. So you have, I always say for physiotherapy, anything, any joint that you are treating, give 10 minutes for the modality you want to use. Please use some bhakti therapy. I call it bhakti therapy, diathermy, ultrasound, SSF, all this bhakti, light is used. So you have to give bhakti therapy, otherwise patient will kuch nahi kiya. Right? And 10 minutes, use your hand on them. And 10 minutes, make them do exercises. So in 30 minutes, your treatment is over. In neurological condition, it's a little more, 45 minutes to 1 hour. So this is what you all are going to do. Right? Now I'm going to assist and push a little more to get him more range. Okay, to your right. Camera. From her, it has come up to camera. So it's an increase in range. So definitely there's a decrease in pain. So if I have to ask you when you came from the scale of 0 to 10, 0 is no pain, 10 is unbearable pain. What was your pain?
Maybe 6, 7.
Okay. Can you say now, feel it, what it is?
No, nothing. 0.
So he doesn't have pain now. So tell me, if I would have given him 50 sittings of diathermy, ultrasound, SSF, I wouldn't have got the range. So please use your hand on the patient. Unless you don't use your hand on the patient, you are not going to get results. Okay. Oh. Look to your right. Okay. You can see anything there? Standing. 2. 4, 2. So I'm not going to go through the chin tuck method. Okay, the self chin tuck. No, I want. There. So you don't need to do it. So what is the homework of the patient? Take a kerchief, towel or a dupatta, hold it there, keep your hand wherever it is and do chin tucks. Right? Keep pushing it. So you are strengthening your paraspinal muscle and you are mobilizing it. You can keep changing it. You can look up and do it. You can look down and do it. It changes the level of cervical. There are others. Next time when I come, at least this is the main thing. If you start doing it as own, they will be very happy. Okay, so in her case, I am not going to do chin tuck. I'll straight go and mobilize it. So she said, 4 was here, 2 was here. No, I don't want to change. See this? Support the head on your chest. Support it. There and a click. Right. You don't know anything. You don't. Just leave it. And you don't nothing. Here it is. There. Right. There and one click. Okay. Go and sit there. You won't imagine me now. Oh,
कितना फर्क हुआ? 6.
oh, 6.
From 2 to 6.
Okay. Sit better. Thank you.
Sir, चमत्कार को treat from the best of the world.
Please don't forget, this is the main exercise. Those who have children at home, make them. So, earlier the children used to lie down on the stomach and put the leg up and used to object. You don't have to do that. The kids used to sit like camel, used to object, but today that is the best. Right? So this under your chest. Half an hour morning, I play with my mobile, I read my emails in the morning, answer everybody this. Right? And night before I go to sleep, I read a book or something. Okay. This we are unwinding. This is one of the best exercises for the spine, alignment of the spine that covers the neck, thoracic and lumbar. Okay, and then for the neck, what I showed you with the dupatta. For the back, you can form a 4 if you have lower back problem and SR. This opposite side, okay, and you can come up. That's this is if you have a back problem.
So we have one
I have two spine surgeons. I have two spine surgeons in Bombay. So before surgery, when they plan the surgery, the patient has come to me. They have said in the conferences, Ali takes away our patient from our throat. Right? They are ready for surgery, but always you will get fantastic results. Start extension. I remember myself in 1985 wanted any back problem, slip disc, lying supine, traction, 15 days, 20 days. Now it is reverse. Day 1, prone, pillow under the chest, bring them up, the disc goes back. If I had a model of spine, I would have showed you all why I am doing extension. Right? The disc goes back. Right? And please, every back problem is not this. Majority of them are up slip or down slip. See where my wallet is? Never put a wallet behind. You are sitting on something where you get a SI joint out of alignment. So please check up slip, down slip. Hopefully next time I come, I'm going to ask the VC to get me a whole day. I have to come here morning, start at 8 o'clock till 6 in the evening. I will talk. I'll demonstrate whatever I know. Whom you can see. The guy standing there.
How many chairs?
The chair you can see. Sitting on chair. Or you're seeing there 4 people sitting there, right? All 4 you can see. The last one is standing. Can you raise your hand? See. You can see him raising the hand? No. Look here. Which one? How many you can count? 1, 2, 3, 4, 5. This one, first row. 7. First row. 6. First row 6. And the guy standing there. So I don't think I should show you all the technique. Again, just to remind you all, thumb, use your thumb. She pushes back, push your neck back. Push your head back, relax. Push again, relax. Push again, relax. I'm on the transverse process. I go on the spinous process. Now push back, push it, push again. Atlant occipital joint.
हाथ खड़ा करो दिख रहा
You
है?
can see.
Yes.
And
Wow.
anything more from there? Any of the people sitting there? You can. Okay. Look at it. That's it. How many you can count? You can see the guy raising it here. 10.
10. Great. 70 10. Very nice.
Wait, mobilize the person. I was thinking that I can do it in supine. There are many ways to mobilize. We do it in supine, we do it prone and sitting. So,
You need something?
you want it?
Can you go on the floor?
I'm just mobilizing. The other way to give traction, we don't need to really hang the patient nowadays. Okay? So just put your wrist under the head. So from supination, I will do pronation. Supination, pronation, supination. I'll bring her this side. Wait. Right? Supination to pronation. That's traction 1. 2. How I'll mobilize.
Oh, chair लगाते हैं. Chair लगाओ. It is.
If I would have taken her height, if there was a proper measurement, After I treat the spine, there will be an increase of 2 centimeters in height. We all of us lose it in our thoracic area. Come here. They have not seen you. Now lie in the stomach here. Okay, so okay, look at me one second, don't worry. My one hand goes below the scapula, above the scapula, and there's a twist. Right?
खड़े होकर देखना है तो देखो बच्चों. You won't get the chance. खड़े होकर अपनी जगह.
So,
if you are not able to see this,
yeah.
if you are not able to see this, see.
Please listen. I'm under the scapula. No, I'm under the scapula, above the scapula, and I push. See? She is feeling the clicks. Okay? So, now, but do both sides. Now look this side. Look this side. Again, under the scapula, above the scapula, and one push. And I reverse it. Few pushes at the thoracic, mid-thoracic, where the flexion happens. Okay? And lower thoracic is going to be, I'll just twist him. Twist him. And now face me. Lie one side. So I'm going to use the lumbar now. Thoracic is over. I want your hand under your head. Keep your hand here. This leg goes here. This bends here. See, there's the rotation at the lumbar. Other side. Walking. Bend this. Keep your hand there. Vertex. Come. Sit here. How many? Huh? 10.
Ten, 16, from 2 to 10, and 7 to 16.
Okay.
Amazing.
In sports field, you don't get enough time. I won't get all this time. So I run on the ground. I know the person is lazy, we need to mobilize. So I'll show a shortcut. Okay. So you're going to hold your neck like this. Behind. Very well. Leave it there. Leave it there. Right? Okay. Now how do you feel? Tell it.
करो तुम nervous हो इधर आओ.
Look at happiness on her face.
Experience और कैसा लग रहा है?
It's good.
Are you now proud that physiotherapy join किया तुमने? हाँ? निशब्द कर दिया सर ने आपको. Great. आशीर्वाद हो सकता है.
Okay, please understand, her height would have increased by now, right? I feel if all of us can go to the sports field like this after all this, or go for an exam like this, because I released all those points which is there for stress, right? I got the mobile. Increase in range is decrease in pain. You don't have to then cross-question the patient. So if I see the range increase, I'm happy, the patient will be happy. You don't have to worry. Any questions on this? This is your bread butter we jam. Only do this. All can survive in life only doing this. 85% of Indians have a neck problem. 85% of them have it. Start doing it at home to your parents. Do it those are staying in hostel. Do it amongst each other. Keep increasing your skill on this. Mobilization of thoracic, cervical, lumbar.
Come to a block. You will find lots of patients. 2 questions. You can raise your hand, you can introduce yourself and then you can ask the question. That can be a question, sir. क्योंकि चमत्कार वैसा नहीं होता सर.
मैं पहले भी बताया दिल से करो. please, I gave all the explanation. Skill yourself. At least once a year, go to a good conference to learn. And I hope your principal will continue to have this conference every year and get all the experts from all over India.
There is applause for Dr. Anshet, our principal. It is appreciated.
DC बेटा है, permission ले लो.
Sir, NIMS में ऐसी activities के we have permission, full permission. You need to just come and tell us.
Yeah.
So, sir, this is Dr. Nandini Kushwaha, and my question is, sir, how can someone be so amazing? So, we're looking forward for the answer.
I don't know. I just know what is in my. I'll tell you a nice story. Bulbul sings very well. They sing. So some people said, "Oh, Ganga का पानी पीता है." Some said, "नहीं, शिमला का सेब खाता है." And some said, "नहीं, वो समर में कश्मीर जाता है." So it's the weather of Kashmir. Some said it is apple of Shimla, and some said it is the Ganga's water that makes it. So when they asked the Koyal, he says, "No, neither I go to Kashmir, neither I have apple from Shimla, neither I drink the water of Ganga. But whenever I sing it from my heart."
Thank you so much, sir.
So certain topic, if I don't know, certain topic that I don't know, I don't talk on it. At politics I am zero, so I will never know which party. I treat everyone, all the parties I treat. And I am not interested to know who is from which party. Because I treat them as a patient. I never bother. And when the stars come to me, I don't bother to take a photograph with them or click or what is special. Nothing. We had one of our staff was treating Shahrukh for his knee. And he is super duper intelligent. He saw the girl nervous and knew that she wants to treat him. Didn't say anything, took all the treatment. So after 40 minutes diatemy, SSM, ultrasound, we went to the spot, everything. She asked, "How are you feeling?" He said, "You treated my right knee. I have all my problem in left knee." And so he understood he is very. So it's, if you are going to show all that thing with them, just be normal. They love when you are normal. They love when you are just going to treat them as a patient. So treat them as a patient. They love it.
Great, thank you, sir. I think being simple is the most difficult thing.
I feel whatever I've learned is they say when a tree has a lot of fruits, it goes down
True,
more.
that's true, sir.
So I feel with time, 35 years that I've been practicing, I've only learned that. And then I'm not modern. Morning they told me to come in suit and tie and all that. Otherwise, if they allow me, I will just come in burqudal and a t-shirt and speak at any conference. Right? So it's not that I need to, but you have to keep the decency, decorum of inauguration, ministers coming, somebody coming. So to keep up with that, otherwise I am very simple. If you tell me roadside, so yesterday they came to pick me from airport. They were talking. So they were talking about big names of. I said all that I can go and I've eaten in all the 5 stars. Raste mein koi dhaba milega. We wanted the roadside dhaba too.
Anshe sir, sir को रावत की प्याज की कचौरी जरूर दिलवाइएगा. Famous प्याज की कचौरी. प्याज कचौरी. It is world famous.
I have a patient coming from Jaipur in Mumbai. He at least every 2 or 3 months he gets the kachori.
Wow. So Anshe sir, now we have to.
I think the message of the whole thing is you have to work hard, you have to be skilled enough, and all that. But I think what I got message for me is whatever you do at Shahrukh Khan's movie, Dil Se. I think whatever he does,
Dil Se.
Dil Se.
Yes, sir.
That
Very
Dil
good.
Se should be there. I'm a heart specialist, so I believe in that.
Sir. So from a heart specialist, direct Dil Se. Very nice. Well said, sir.
Be
Well
nice
said.
to your patients, please. I've received a lot of complaints from parents. They call me. And please call them also. So when you're going home, if you give a call to your mom, "I'm coming home, you need anything," they will feel nice. And once in a time, a number of days she makes tea for you and food for you. Sometimes if you are at home, you also make a chai for them.
What a sir.
See, I see 3,000 physios coming out every year. 3,000 physios coming out every year. Hardly 10 of them make name for themselves. When I meet all 10 of them, I find out they are very, very close to their mom. Right? So the blessing, in all religion it says, if there is heaven, it is under your mother's feet. So maybe, I'll tell you an incident. I'm talking about 85, 86, just started practicing. So I'm very close. I lost my dad 10 years back. I lost my mom 3 years back. I was very close to them. So it is very important. Flat next to my mom's flat was on sale. So that time, I'm talking about in 80s, the price was 6 lakh rupees. But the guy asked me 14 lakh rupees. So I asked him, black mein kitna chahiye, check kitna chahiye. So he said, I just said 14 thinking will reduce. I said, I don't deal when it's my parents. You tell me your price. And I'm saying that. I'm just saying that. I'm staying in that flat, then I bought the next flat also, now doubled it up so that it is big. But I wanted to be close to them. Morning I had to have, while going to the hospital, I had to meet my mom if I was in Mumbai, or give a call if I was not in Mumbai. And night before sleeping, a number of times I've told her that 7 o'clock if I was not at home, 7:30 I should get a call. Okay, where are you? I said, Mom, I'm 50 years old. You're still asking me where I am. He says, no, I thought you have not come to meet me. So this is how your relation. Please call, at least call. A lot of mothers are complaining. Please, they spend a lot. I never want a parent to tell you, at least let your parent tell you paisa vasool, whatever we have spent on you. My dad had plantar fasciitis. I treated him with moxibustion, it's a Chinese method. One treatment. If the patient gets all right, it's just one sitting. Moxibustion through ginger, I gave, through ginger. Hopefully next time when I come, I'll demonstrate here. So one treating, next day morning I got very scared to go near him. He thought the pain is increased. He said, call me, I have some work with you. I said, yes. He says, whatever I have spent on you, vasool. I said, what happened? He said, my pain went. So please get them from your parents. And believe me, the start is this technique that I showed you all for neck and back. Open up the neck, open up the back, they will feel nice. And they should. You know, the healing hand comes with their blessing. Thank you.
I think we have a wonderful session. Just a small announcement. Anybody who, because you have seen Bollywood stars, anybody who wants Dr. Ali Irani's autograph has to come here on time tomorrow. And then we will give his autograph.
No. I have a flight at 1 o'clock. So I'm going to start at 11 o'clock. I don't mind even if 5 people are sitting, it doesn't matter to me. Because I feel I have to give my knowledge. I'm prepared with my physiotherapy in India. Many people wanted to know. So I'll be speaking in the morning. I feel 9:30 is fact.
So be on time.
9:30 I'll tell you everything about physiotherapy as a profession. Going back to 2,500 years back, the history of, we were before medicine. Physiotherapy was before medicine. I will prove that to you. And I'll come down what is the latest and what are the new specialties that will come. And from here I'll straight go to the airport. Thanking them. Lovely to see your campus.
We are looking forward to that session. I think
We started
everyone.
with coffee, now we are almost at dinner now.
Oh, so we started coffee and we are almost. You have the message.
Thank you. I can only pray for you all. May God give you all a healing hand. That is the most important part. Thank you. Keep this set.
She wants to ask one question.
Yes, go ahead. Go ahead. Please ask all your questions now. Ask. Yes, go ahead. Okay, she got it.
Good evening, sir. My question is how we balance theory paper and practical paper, because we have to study lots of subjects.
Listen, I have never been to a library. But when I was sitting in the class, my concentration was on the professor. I could grasp everything the professor said. If any question that was taken, now also I tell my staff, Never ask a question which has not been taken. If the lecture has not been taken, don't ask that question. Your body, this mind that we are working is only 8%. 92% is still waking. So when you are in the class, you are playing with your mobile, you are trying to write. When you write, neither you listen. So please, that system of writing notes has gone. Be alert, sit like that, and think you are recording, and your brain records. Right? So for me I've never been to a library, and always throughout my career in first three, either I was second, either I was third, or I was first. Certain subject I was good. Like anatomy, I was always first, nobody could, because maybe I was more into dissection, and I should love it. Right? But if somebody was there, physiology, maybe I was second. Right? So in all subjects, if you are attentive, it's like today some of them have grasped everything that was said. So studies is like that. There is nothing in practical, nothing in theory. Whatever the subject is, don't by heart. Many of the students think they will by heart that question aane wala hai, so by heart it. No, you should understand it. And write in your own words, as if I was an examiner, I love to read. I come to know. I take PhD exam, entrance exam for Bombay University, and Master in Fine Arts. I take exam. You will believe I make the students sit in the library of the college without any supervisor. If I have to correct the paper, I know whether they are writing it from the book or they are writing in their own words. So you are allowed to write Master's Fine Art exam sitting in the library of your college. I don't mind. I close the door from outside. After 3 hours, I'll come and take the papers. I'm not interested to know. Let them copy. You come to know. So please, if you change the system of understanding, please, the brain regenerates, right? The brain resets from 11 to 4. So if you say instead of 11, I'll sleep at 12 and get up at 9 in the morning, you have lost 1 hour. So by 10, and best eating is early eating, 6:37 eat, right? By 10 you should be in your bed, by 11 you should fall asleep. Right? So when you come, your body has reset it well. So whether you get up at 6, 7, 8, 4 o'clock, but don't cross the 11. You cannot be awake after 11. The resetting time goes, you are wasting. The regeneration that has to happen is not happening. Right? So learn, get up early morning. Whatever you were doing WhatsApp at 12 o'clock, do it at 4 in the morning. Let everybody get up. You start sending them. So these are the simple things. Let's learn from the animals. They do that. Right? They get up early morning. First thing again when they get up, they go and have water. They will go to a riverside wherever there is water. Right? We don't. So get up in the morning, get 1 glass of water, 2 glasses of water. Right? Sleep early. Do at least some exercises, whatever. Walking. I always tell students, some part you should walk. So don't go for trains, don't go for buses everywhere. Whatever you can walk, walk. Instead of taking a bus outside here, go walk to the gate and tell the bus, I'll sit from there. Get down there and walk in. Right? Always take steps. Don't take elevators. When you are taking steps, hopefully next time I do a lecture only on fitness, I talk. When you climb the steps, you are burning 2,500 calories. When you are walking, I call it gossip walking. So I told the students from Mangalore, after they should have a dinner at 7 o'clock. Right? And all of them complain they are putting on weight. So I said, chale jao, walk at this far. So after 2 months, when we saw all had increased weight, so I found out, started asking them questions, where you are going to walk? He said, वहाँ तक जाता है ice cream का दुकान है. So they burn 400, 500 calories, they eat an ice cream which is 400 calories. You getting it? So they don't burn, they eat. So I said, no walking. So it's again, I always tell, if your parents give you 200 rupees every morning, you are going to college, this is 200 rupees. So if you are going to spend only 50 rupees, at the end of the month you have saved something. So when you are eating, we human beings were not made for 4 meals. You have breakfast for home, come here and somebody is going to canteen, you go to the canteen and have breakfast again with that person. Right? Then you want lunch, then evening you go home, you want something, again dinner you want. Eat 2 meals. You have made 2 meals. But see the number of meals that we take, and then fried. Right? Hopeful? Good. So be alert in your class. Grasp it. I have never written, you will never find my notes. Never. And still I was talking. But be attentive in that class. See what the person is saying. Spend time, a professor does a lot of study to come and talk on that topic. Right? And you want to write. So the faster you try to write, you miss something. So you have not recorded. You have not written well. So both ways, when you want to read, you themselves don't know. They say a housewife complained to the husband. Husband was a doctor, so he used to write letters when he was abroad. So he said, please don't write long letters. The chemist refuses to read for me. So you got the chemist to read. Right? So your notes are like that. You yourself can't read it after you have written. When you are revising and you want to read it, you are finding it, it's not making any sense to you.
Good.
Any questions?
Any more questions? Should we wind up with it? One more. So we'll take the last question. Then if we find time tomorrow, we'll have that. Yes, last question.
Good evening, sir. My name is Anubhav Anand and I'm a second year physiotherapy student. सर मेरा सवाल ये है कि हम कुछ बड़ी ऊंचाइयों को छूना चाहते हैं या फिर कुछ ऐसा बड़ा इमेजिन करते हैं, विजन देखते हैं, तो हमें सबसे पहला पॉइंट ये दिखता है कि हमें ओरिजिनल होना है, यूनिक होना है. तो सर ये ओरिजिनलिटी कैसे आएगी अपने ट्रीटमेंट में, अपने प्रोटोकॉल में, अपनी थिंकिंग में?
हमने इस पे बात की है दिल से. आप अपने पेशेंट का sometimes what happens, a patient comes to me and praises a physiotherapist. So I ask, is she treating you? No. Somebody else is treating, but this was the person who has received it. Can I help you? Like, finds out from the card who was treating what. Please, your staff is busy, I'll call you. Being that nice, so that blessing of the patient goes to that staff. Right? So just be nice to all of them. 50% is done if the way you behave with your. I have to give you an example. You must stand like this. It is my humble request. Does it sound humble? No, sir. But if I say, it's my request. So the body language shows. Yeah, the request is humble. So be nice to your patient. Believe me, it makes a lot of difference. Your 50% treatment is how you deal with your patient. You can't scream and shout out that you want to know you either. I'm बुलाएंगे जब आपका turn आएगा तो. No. You have to win hearts. Whether it's your colleague, whether it's your teacher, whether it's your peon, whether it's your classmate, college mate, university mate, you have to start winning. So learn that. Yes, sir. Less followers. Yes. Thank you.
Thank you. With this, we end this session. So thanks a lot. Thank you, sir. I think we can listen to you for the whole night. It's been so interesting, the anecdotes, the way you have demonstrated how it is done. That's why you are the best in the town, in the world actually, sir.
Standing ovation. You should give a standing ovation.
Now I request our Vice Chancellor sir to please present a memento, Dr. Irani sir. It's our very small way of saying thanks for taking out time and interacting with this so informal discussion. I think the objective of coffee with Irani has been reached. Good to see you in this session, sir. Thank you. Thanks a lot once again. And
Thank you for your patience.